Blood glucose control is a critical aspect of managing diabetes. People with diabetes must monitor their blood glucose levels regularly to ensure that they are within a safe and healthy range. In this article, we will discuss the importance of controlling blood glucose levels, how to monitor blood glucose levels, and how to interpret and act on blood glucose readings. The importance of controlling blood glucose levels. Controlling blood glucose levels is essential for people with diabetes to prevent or delay complications that can arise from high blood glucose levels. These complications can include heart disease, nerve damage, kidney damage, eye damage, and foot damage. The longer someone has uncontrolled blood glucose levels, the higher the risk of developing these complications. Blood glucose levels that are too low can also be dangerous, leading to hypoglycemia or low blood sugar. Hypoglycemia can cause symptoms such as dizziness, confusion, sweating, and even seizures or loss of consciousness. Therefore, it is essential to maintain blood glucose levels within a safe and healthy range to avoid both high and low blood glucose levels. How to monitor blood glucose levels? There are several ways to monitor blood glucose levels, including self-monitoring of blood glucose, SMBG, and continuous glucose monitoring, CGM. SMBG involves using a blood glucose meter to test blood glucose levels at home. CGM involves wearing a device that continuously measures blood glucose levels and provides real-time data about blood glucose trends. SMBG is typically done by pricking a finger with a lancet and placing a drop of blood on a test strip, which is then inserted into a blood glucose meter. CGM devices use a small sensor inserted under the skin to continuously measure glucose levels in the interstitial fluid. The sensor sends data to a receiver or smartphone app that displays glucose readings in real time. How to interpret and act on blood glucose readings? Interpreting blood glucose readings is essential to help people with diabetes understand how their lifestyle choices and medication affect their blood glucose levels. Target blood glucose ranges can vary depending on factors such as age, overall health, and the presence of diabetes complications. However, a general guideline for target blood glucose levels is as follows. Fasting blood glucose, 80 to 130 mg/dl. Blood glucose before meals, 80 to 130 mg/dl. Blood glucose after meals, less than 180 mg/dl. If blood glucose levels are consistently above or below the target range, adjustments to medication, diet, or exercise may be necessary. Working with a healthcare provider or diabetes educator can help people with diabetes manage their blood glucose levels effectively. In conclusion, controlling blood glucose levels is crucial for people with diabetes to prevent or delay complications that can arise from high or low blood glucose levels. Monitoring blood glucose levels and interpreting blood glucose readings are essential tools for managing diabetes effectively. By staying informed and working with healthcare providers, people with diabetes can achieve better blood glucose control and improve their overall health and well-being. Blood glucose control is a critical aspect of managing diabetes.